So this is my culminating conference presentation for the University of Victoria School of Public Health and Social Policy. My name is Fawn. I want to start with a land acknowledgement. I have the privilege of presenting on the unceded land from the Coast Salish people, the Squamish, Tsleil-Waututh, and Musqueam nations. And I had the privilege of completing my Bachelor of Arts in Health and Community Services with a focus on Indigenous people's health at the University of Victoria, and humbly acknowledge the Lekwungen people on whose traditional territory the university stands, and the Songhees, Esquimalt, and Wasanich people whose historical relationships with the land continue to this day. I want to recognize my positionality. I'm a white, able-bodied, cisgender woman, Canadian by birth. I'm a member of the 2S LGBTQI+ community. However, I am in a heteronormative relationship, and I am university educated. I had the privilege of completing my practicum with the LGBTQS+ Dignity Project alongside Dr. Berenger, who, as you all know, is an assistant professor at UVic and the director of the LGBTQI2S+ Dignity Project. And the agenda for the duration of my presentation is I'm going to cover my practicum summary, PHSP skills, values, and knowledge areas, my chosen call to action, key insights, professional development, and self-reflection. So for my practicum, phase one was research. So my goals were to research how knowledge translation has evolved over the past 20 years, determine what products are currently trending in knowledge translation, and determine what activities are most efficacious for this community. The method in doing so was a mini literature review, which was presented in the form of a 35-page annotated bibliography, which outlined key findings, ethical considerations, and knowledge mobilization efficacy. The goals phase two development, the goal was to create a unique 2S LGBTQI+ knowledge translation mobilization product for use on the Dignity Senior Society website with information and resources for end-of-life care planning. The product that we chose, so in consultation with Dr. Berenger, I decided to create a multimedia video discussion on aging with dignity for 2S LGBTQI+ seniors in British Columbia. And the conversation was based on a needs assessment, which was led by Dr. Hines and Dr. Berenger. So the Dignity Senior Society, a little bit of background about them. They are an organization that aims to improve the conditions of today's older two-spirit, lesbian, gay, bisexual, transgender, queer, and intersex individuals as they plan for end-of-life care. PHSP skills. So one of the skills I focused on was examining the role of community engagement and community leadership in promoting population health and social justice. So Hines and Berenger noted that 2S LGBTQI+ older adults are more likely than their heterosexual peers to age with limited support in stigmatizing environments and are often poorly served by traditional social services, which challenges their preparedness for end of life. So using their collective skills in community research, Dr. Berenger and the team at Dignity Senior Society, in particular, Dr. Hines and Dr. Berenger conducted a needs assessment with recommendations as to how policymakers and health and social service providers can minimize health inequities to best serve 2S LGBTQI+ seniors. PHSP values. So I chose community-based approaches to research and knowledge. So all of the interviews that we conducted for our video were done with board members of the Dignity Senior Society. So there was Darren Usher, who is the chair of DSS, Adrienne DeVries, who is the vice chair of DSS, Dr. Matthew Hines, who is a professor at Royal Roads University and DSS board member, and Dr. Robert Berenger, who is an assistant professor at UVic and DSS board member. So the needs assessment was based on research done at the Dignity Senior Society and a paper called Aging with Dignity for 2S LGBTQI+ seniors in British Columbia. And so in that needs assessment, the research involved 51 individuals who participated in one-on-one interviews and 115 individuals who completed online surveys. So this really was important to me because it's engaging with the community members themselves and hearing directly from them, where the gaps in service lie and what they need in order to move forward in their end-of-life care planning. The PHSP knowledge area focused on was improving health and reducing health inequities in communities through identifying and addressing problematic social and life course determinants of health. So within the extensive research that I reviewed, I identified intersecting factors such as social isolation, discrimination, housing instability, trauma, and culturally unsafe care, and how it negatively impacts this community and contributes to their ongoing health disparities. And in response to that, created a knowledge translation product that specifically targets the areas which have been identified as being of primary concern, and provided information, resources, and recommendations to assist US LGBTQI+ elders in their end-of-life care planning to help improve these social determinants of health. The Truth and Reconciliation Commission call to action that I chose was number 24. We call upon the medical and nursing schools in Canada to require all students to take courses dealing with Aboriginal health issues, including the history and legacy of residential schools, the United Nations Declaration on the Rights of Indigenous People, treaties and Aboriginal rights, and Indigenous teaching and practices. This will require skills-based training in intercultural competency, conflict resolution, human rights, and anti-racism. So one thing for this, I think it maybe needs to be, the wording needs to be a little bit judged because I think it's all health care and social service providers. In particular, I've noticed that, for example, in long-term care facilities, it's often the carers that have more face-to-face time with individuals than the doctors and nurses do. So I think that anybody who comes into contact with Indigenous individuals should have a basic understanding of some of the historical issues that have been faced by that community. Finally, I think we need to provide formalized structures within Canadian healthcare settings that support and guide healthcare staff in working with Aboriginal leaders to provide access to cultural services while protecting cultural knowledge. I am working for the Provincial Health Services Authority now, and I've noticed that they do have what's called the Sanyas training. So that's really exciting for me, and I'll touch on that in a little bit. So key insights for me in my academic journey and throughout my practicum was the importance of critical self-reflection. It doesn't matter how much knowledge I possess if I cannot apply it in a way that resonates with those I'm engaging with. And it doesn't mean that I'm going to be infallible. It does, however, mean that I'm more likely to recognize when I make mistakes and take that as an opportunity to learn and grow. I've also noted the importance of relationships that are built on compassion, reciprocity, and trust. The importance of being vulnerable and authentic. By demonstrating vulnerability and authenticity, it allows me to create spaces for others around me to do the same. And finally, I have touched on this before, but I believe everybody should act in accordance with their profession. However, I don't really enjoy the word professionalism because I think that sometimes it inherently reinforces power dynamics and hierarchies. So I prefer to align with the 7 sacred teachings, which is professional conduct based on teachings that are integral to many Indigenous peoples, and cultural values, which are wisdom, love, respect, courage, honesty, humility, and truth. Professional development. For here, I've noticed the importance of psychological safety. So it's the importance of building confidence and trust that I will not embarrass, reject, or speak negatively, nor will I engage in harmful behavior such as gossip, destructive comments, or the spreading of rumors that will impact morale with the team I'm working with. Cultural safety, being aware of and addressing power imbalances in the healthcare system. Cultural competence, my ability to respond respectfully and effectively to people of all cultures, classes, races, ethnic backgrounds, sexual orientations, faiths and religions, in a manner that recognizes, affirms, and values the worth of the individuals and communities and protects the dignity of each. Being humble and knowing my limitations, I think that not knowing is not a sign of weakness, in my opinion, but rather a space for learning and discovery, and it communicates to those around us that we are aware of our limitations and eager to learn, which fosters a relationship built on trust and honesty between myself and my peers. And of course, continual learning, understanding that knowledge, especially in relation to the Indigenous community, as it's rapidly expanding and each community has such varying needs. So it's imperative that I, as a professional, commit to continual learning so I can stay current with best practices. Finally, highlights and challenges. Pardon me if I get teary here. My highlight, this entire journey has been a highlight. And my practicum was incredible because it gave me the opportunity to work with communities that I feel very passionately about. And as a woman, I also recognize that it's such a privilege to obtain an education at all. So although there was challenging moments throughout my degree, I recognized how much of a privilege it was to be able to attend. And so I'm have so much gratitude for the opportunity to attend university. Challenges mostly with my own self-doubt and struggles with mental health that got in the way along the journey. In particular, I gave birth during exams last year to a daughter, and I struggled with severe postpartum depression and anxiety afterwards. But I was overwhelmed by the support that I was given from my peers and the faculty, and that really helped me overcome those feelings of self-doubt and overwhelm. Future academic ambitions is I would really like to pursue my master's in public health with a focus on social policy. And I want to keep in line with Indigenous people's health as well, because I feel very passionately about that. Career. So I actually just received my first job offer. It was the first job I applied for after university. So I started last Tuesday at the Provincial Health Services Authority in the Indigenous Women and Children's Department at BC Women and Children's Hospital. They've already been so welcoming and just absolutely incredible. And I've already been able to participate in the smudging ceremony. And I'm so overwhelmed with gratitude that I get to continue on this journey and have found a job that completely intersects with the two populations, which is women and children and Indigenous people's health, as I move forward in my career. And then my final thought, I just wanted to say how incredible and inspiring this journey has been. And it's really planted a seed of hope within me that if our other universities are educating the minds of the future with the same emphasis on equality and social justice that I've experienced at UVic, the world would be a much safer and more equitable place for all of its citizens. And I want to extend gratitude from all the encouragement of the faculty and my peers, in particular, Natalie. You have shown me more than I could have ever asked for, and you've just been such an inspiration to me. Dr. Berenger, thank you so much for this opportunity to participate in a practicum with you. Jill, Aislinn, and Maddox, they graduated last year, but they were very influential. But yeah, when I started this journey, I didn't think that I had the capacity to succeed. And I had a lot of people telling me I couldn't. And the support that I've been shown here has been so incredible. And this has been so much more than an academic journey. And it's going to be something that I take with me for the rest of my life. So thank you.